Aloha. Joining us here in the studio today, we have Christina Teal, Department of Health Cancer Programs Coordinator, and Joanna Udasco, RN Department of Health Cancer Programs Clinical Nurse. And today we're going to be discussing cervical cancer. And Joanna, I want to start with you. Tell us a little bit about the genesis of what exactly cervical cancer is.
Well, cervical cancer is a disease where the cells in the cervix, that's the lower part of the uterus, become abnormal. The cells multiply and they grow out of control, forming tumors. All women are at risk for cervical cancer. Many cervical cancers are caused by the human papilloma virus, or HPV. HPV is the most common sexual transmitted infection. Now, not everyone who has HPV will have cervical cancer, but if your body isn't able to fight off the infection, then it can lead to cervical cancer. And each year, 13,000 women in the US are diagnosed with cervical cancer, and nearly over 4,000 women die from it. But fortunately, it's the most preventable cancer. HPV immunizations and screenings have significantly helped to detect and prevent cervical cancers in patients earlier.
What are typical symptoms of cervical cancer?
Unfortunately, early on, cervical cancer may not show any signs or symptoms. That's why it's important to have regular screenings. Once the cancer has progressed, advanced cervical cancer can cause unusual vaginal bleeding, for example, after intercourse, between menstrual periods, or after menopause. It can also cause watery, bloody vaginal discharge that may be heavy or have an odor, or you might experience pelvic pain. If you have any of these symptoms, you should consult your doctor or a healthcare provider.
Christina, what are preventative measures that women can take to maybe lessen their likelihood or chances of getting cervical cancer?
Cervical cancer can be detected through screenings such as the Pap test and the HPV test, and it also can be prevented through vaccination with the HPV vaccine. And as Joanna mentioned, symptoms are often not shown early on in cervical cancer, so that means the screenings are very critical for a woman. And the Pap test is a test that can find changes in the cervix that are precancerous and be detected early for treatment. The HPV test looks for the virus that causes cervical cancer, and the HPV test and the Pap test can be done at the same time, called a co-test.
Okay, and when should the HPV vaccine and these other screening tests take place?
Well, according to the Centers for Disease Control and Prevention, the HPV vaccination is recommended for all adolescents age 11 and 12. The Pap test for women starts at age 21, and the HPV and Pap test co-test starts at age 30.
And are any of these screening tests covered by insurance, or how do people go about doing that?
Most insurances do cover the screenings, and cost shouldn't be a barrier to getting screened. So if you have no insurance or have insurance that doesn't cover these screenings, the Department of Health Breast and Cervical Cancer Control Program does provide free screenings for eligible women for breast and cervical cancer.
For more information about cervical cancer or the Department of Health's Breast and Cervical Cancer Control Program, you can visit health.hawaii.gov/cancer.